We've seen a few negative studies. Elena and I were talking this morning saying what a disappointing year this year at ASCO for the GE cancers. So we talked about KEYNOTE-061. There was also the avelumab data, the JAVELIN trial. Eric, can you tell us a little bit about this maintenance concept?
Well, there are two JAVELIN trials.
Yes.
We have seen the results of one JAVELIN trial, that's JAVELIN 300,
Yes.
which was a study in later lines
Yes.
where patients were randomized between avelumab, which is a PDL antibody, versus any choice of chemotherapy, taxane, irinotecan, or best supportive care. And that study did not show a benefit. The other study, the JAVELIN 100 study, is a study in the maintenance phase.
Yeah.
That study is still ongoing. We don't have yet any results. And that's a study where patients are started with chemotherapy in the first line. And then in the maintenance phase, after a certain period of chemotherapy, in those patients without progression, there is a randomization between avelumab or continuing a maintenance chemotherapy. That study is still recruiting today, and we hope to see the results, of course, in the future. But the study, the JAVELIN 300 study, was indeed a study in later lines. The difference with the NIVO study was here that there was the control arm in this study was chemotherapy, irinotecan or a taxane in later lines, while in the NIVO Japanese study, it was NIVO versus placebo, which is a different design and a different setup. And this just learns that we have to better select, as Elena said, our patients to come up with biomarkers, predictive biomarkers. And in the avelumab study, all comers were included. There was no enrichment for a certain biomarker. There was no enrichment for PDL or for EBV or MSI, so it was just all comers. And that's an important message. That's probably not the way to go in gastric cancer. With checkpoint inhibitors, we have to select patients.
Yes, and then we saw also the thought of a stem cell inhibitor. So Dr. Enzinger, tell us a little bit about what are these stem cell inhibitors in this brighter study that we saw?
Yeah, so this is the agent is BBI 6, I think it's 608, I forget the number behind the BBI. Basically, this is a stemness cell inhibitor, and the idea behind this is that cells are actively dividing in general, and these are cells that can be killed with a cell cycle poison, which is what most chemotherapy is. And the idea is that there are certain cells that are quiescent, or stem cells, that are much harder to kill. And the idea with this agent was that it affected this, and there's various ideas of exactly how the agent works, Wnt signaling or other mechanisms. But the bottom line was that this agent was combined with paclitaxel in the second line, so paclitaxel with or without this agent. And unfortunately, based on the data that's available to us at this point, we know that the top line result was negative with this study, and there was no benefit to adding this agent to paclitaxel in the second line setting.
And then we have another negative study, the rainfall study. So Peter says
Sure, yeah. Rainfall was, of course, a big disappointment, in particular to Elena and myself as well, because we had a follow-up study that we had planned that fell through. But the bottom line is that we now have another study that shows no benefit for an angiogenesis inhibitor in the frontline setting. This was a study that looked at a platinum 5-FU frontline regimen with or without ramucirumab. Given in a different way, actually, than given in subsequent lines of therapy. The idea was actually to give higher doses of ramucirumab, so it was given on day 1 and day 8 on this 3-week cycle. But the bottom line, although there was a small statistically significant improvement in progression-free survival, there was no improvement in overall survival in this trial. And unfortunately, for that reason, the company that makes this agent is not pursuing a frontline indication for this agent. So we now have 4 studies that show no benefit in the frontline setting, the AVAGAS study, the AVATAR study, RAINFALL, and the ZAMIGA study. So there's no real proof right now that a frontline angiogenesis strategy works. And I think we're just going to have to go back to the drawing board, and perhaps we can find better agents, or this is more of a second, third line drug. But it was clearly disappointing to all of us.